It was playoff game, late in the game, fourth quarter. We had just took the lead. I'm playing defense, and I took a push slide, and just our momentum was going opposite directions at the same time. And she stepped on my foot, and I felt a pop immediately. When I tried to walk again, it was just, I couldn't. We won the game, but like I knew my season was over. I'm DiJonai Carrington, professional basketball player, proud Vertex partner, and JOURNAVX patient. I saw the doctor the next morning, and I could tell by the way she walked in there, it wasn't good. I knew how much pain I was in. I was prepared for the worst. The doctor confirmed that it was a midfoot sprain. I was devastated. It was a complete 180, emotionally, physically, everything. I had a bunch of questions. I wanted to know, what's the recovery process? What's the timeline? My doctor explained that there were different pain management options available. So when JOURNAVX was introduced to me as a non-opioid option for moderate to severe short-term pain, that's what really stood out to me. I've seen directly how pain management decisions can have lasting impacts, and that's really what influenced me choosing a non-opioid option for my own recovery. JOURNAVX helped reduce my pain during a period that could have felt isolating, so I was able to focus on healing and moving through recovery one day at a time.
Do not take JOURNAVX if you take certain medicines that are strong inhibitors of an enzyme called CYP3A. Ask your healthcare provider if you are not sure. Please keep watching for full important safety information.
When my doctor and I chose JOURNAVX, it was one of the few decisions that we could make that was in our control at a time where everything else felt out of my control. I hope people understand that recovery is about controlling what you can and finding ways to continue to push and move forward. Be involved in the decisions that are being made about your body, about your pain management, about knowing the options. It's definitely been a process of listening to my body, but I'm working hard to get back on the court as soon as possible.
What is JOURNAVX? JOURNAVX is a prescription medicine used to treat adults with moderate to severe short-term acute pain. It is not known if JOURNAVX is safe and effective in children. Important safety information. Do not take JOURNAVX if you take certain medicines that are strong inhibitors of an enzyme called CYP3A. Ask your healthcare provider if you are not sure. Before taking JOURNAVX, tell your healthcare provider about all of your medical conditions, including if you have liver problems. People with liver problems may have an increased risk of getting side effects. Are pregnant or plan to become pregnant? JOURNAVX may temporarily reduce the chance of females becoming pregnant while on treatment. Are breastfeeding or planning to breastfeed? Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking JOURNAVX with certain other medicines may affect the way JOURNAVX and the other medicines work and may increase your risk of side effects. Ask your healthcare provider or pharmacist for a list of these medicines if you are not sure. Especially tell your healthcare provider if you take hormonal birth control medicine, contraceptives containing progestins other than levonorgestrel or norethindrone, as they may not work as well during treatment with JOURNAVX. Use non-hormonal contraceptives such as condoms or other forms of hormonal birth control during treatment and for 28 days after you stop taking JOURNAVX. Medicines that are substrates of the CYP3A enzyme, as they may become less effective during treatment with JOURNAVX. Your healthcare provider may need to adjust the dose of your medicine when starting or stopping JOURNAVX. What should I avoid while taking JOURNAVX? Do not take food or drink containing grapefruit during treatment with JOURNAVX. What are the possible side effects of JOURNAVX? The most common side effects for patients treated with JOURNAVX included itching, muscle spasms, increased blood level of creatine phosphokinase, and rash. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all of the possible side effects of JOURNAVX. Call your healthcare provider for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Please see full prescribing information, including patient information, at journavx.com.